Today we're going to learn how to start an IV or insert an IV on a client. You will have your student checklist and a web CT that will give you step-by-step of the important things that we'll be looking at as we perform this skill. One of the big things that you want to know, as I mentioned before, is to know your patient's history. This is the part of the nursing process that you want to have before you come into the patient's room. You want to do your assessment, and what kind of assessment do you want to have before you do this? First, you want to know the patient's medical history. You want to make sure that you know if there's the existence of history of cancer, specifically breast cancer, specifically a client that had a mastectomy. That is one contraindication of starting an IV on a client, on a female client. You want, the obvious one will be amputation, of course. You have to go to the other extremity. The other option is for a client that has severe diabetes and its own hemodialysis. They will place on the client what they call an arteriovenous shunt, which is a connection between an artery and a vein to allow the technician to perform hemodialysis on the client. Therefore, that extremity could not, it's a big contraindication of not starting on IV on a client that has that on that extremity. So the next thing that you want to do is to look at the patient's fluid status. If your client is dehydrated, you can foresee that the client will have a little bit more difficulty for you to puncture the vein because the veins will be flat, they will be dehydrated. If the client is overhydrated on the other side, it also will be difficult because they become engorged and they actually kind of have a little game to it, and you will have a little difficulty puncturing that vein as well because they roll and they move. Another things that you have to pay attention to is the ability of the client to tolerate the procedure. A client that is confused, that's combative, it's going to fight you, of course, all the way through. So you want to make sure that you foresee any issues that you'll have, and you bring help with you to help you not restrain the client, but just kind of keep him busy while you actually perform the skill. So you are able to minimize the risk of needle stick for you and whoever is helping you. So as you gather all that information, the next thing that you have is to gather all your supplies. What size of IV catheter you're going to use is going to depend upon what it is that the therapy is going to be for. So if you're starting an IV to transfuse blood, you want to have a large bore because blood is a lot thicker than fluids, and you want to make sure that you have a site that can tolerate that type of volume and that thickness. So the preferred size for blood is 18 or 20. Then when you have a client to give large amounts of fluids, most likely you will need a 20 gauge. For maintenance IV antibiotics, you can use either a 20 or a 22 gauge. And then for the other ones, the bigger size is 16, you most likely will see that in the trauma, in the ER, and we really don't use them in the med surg. So basically, you'll see a range between 18 gauge and 22 gauge on the acute care setting. So you make sure you have all your supplies. There is already pre-packed IV start that your institution will have. Then you have your extension tubing. And this is the extension that you're going to prime with saline, and you're going to connect your IV fluids to. You have your saline flushes, and they will be labeled as such, and you want to make sure that that's what it is, that it's saline. You have a blue chalk that can help you collect any blood that you might spill. Of course, your gloves, your hand sanitizer, wash your hands before you come in, and any extra supplies that you think that you might need. Okay? So when you come into your patient's room, you identify yourself, you identify your client, you explain the procedure to them, and then you proceed to wash your hands. And then you're going to gather and put your supplies together in such a way that when you are ready to do the venipuncture, you have everything accessible to you. The first thing that I do is to put a chalk underneath the extremity that I think I'm going to perform the venipuncture. I already have checked all that medical history from before. I have looked and make sure that I'm using an extremity that it's able to do so. So the first thing I'm going to do, I'm going to look into my extremity. I'm going to look for any bruising, any scars, any swelling or anything like that that will prevent me from perform a needle stick. You want to start from distal to proximal, because if your IV site infiltrates on the hand, then this is going to need to be rested, and you want to put either hot compresses or cold compresses, and then you can actually use the same vein but a little bit higher because it's not going to disturb what it's already infiltrated. So you'll have the ability to move up and still maintain the integrity of the IV and to prevent any more complications on your client. If you started up here and it gets infiltrated and all this is swollen, you cannot come down here and start an IV because you actually will be aggravating the infiltration. So you're going to have to move to the other extremity. So you'll open your packet. You already had explained the procedure to your client and wash your hands. You open your packets and have everything available to you. So now I'm going to remove my tourniquet because I'm going to decide which vein I'm going to use. So you use your tourniquet and you apply it about 4 or 5 inches above the site that you think that you're going to puncture. You perform a loop, not too tight, because I've seen people just kind of pull on this really tight that actually will hurt the client. You want to make sure that it's snug, that you will have some type of pressure to allow the vein to fill. There are different ways to do so. You can dangle the arm a little bit and allow the circulation to come down. You can ask your client to pump their fist, opening and closing, or you can softly kind of palpate the vein so it'll fill. So now in here, I have chosen this vein in this area here to perform the venipuncture. Now I will release my tourniquet and I will leave it in place so I have it accessible, and I will tell the patient I'm going to go ahead and get all my things together and I'll come back to the arm. So I'm going to make sure that I have everything ready for me. So I will put everything on the patient's bed right on top of the blue chalk. So you have it available. This is your tegaderm, and the tegaderm is going to have a little part that you will put your date, your time, and your initials, and you peel that off and put it on the side, and I'll show you that in a minute. It has the supply that they will give you to clean. Before we use alcohol pads, now we actually have something that it's less irritant to the skin, and it is only one, so you'll be using a circular motion, and you'll see that when I perform it. You have extra gauzes in here. You have your extension. Now, this is something that you'll see a lot. Nurses will open an alcohol swab and put it close to the patient's site that you're going to puncture, so you can rest your extension and have it easily accessible. You will only have one hand when you're going to incorporate your extension into your hub. So you want to make sure that you have it available and easy access. You're going to open and you're going to connect your saline. Now, if you notice that when I did that, I actually touched my hand, touched that paste right here. So I'm going to make sure that I clean it so it doesn't get contaminated again. I clean it. I will go ahead and remove the cap. I will connect, make sure that I get all the air bubbles out. I will connect. And I will prime. Make sure that I get all the bubbles out. And I will put it in such a way that it doesn't get contaminated and it's easy access. Okay, there we go. And we had the tourniquet. Okay, so I'm just going to go ahead and put my gloves on. And these are clean gloves. I am going to put my tourniquet on, and you have about a minute to make sure that the tourniquet only remains there for a minute. You will break the seal. You clean in a circular motion from the inside out, and you discard. You can actually, if you have too much of the alcohol or their solution, you can use the gauze that's inside there and remove the excess. We don't fan, we don't blow on it, and we clean it. And then we're ready to make sure that you anchor the vein. You get your bevel up, needle at about 10-degree angle, and you puncture You actually tell the patient, I'm going to puncture, and you get it, and you start seeing your flashback. Look what I do with my fingers. I'm holding the hub with my index and my thumb, and I'm lifting the other 3 fingers up. You see how the chamber is filling with blood? Okay, so you will be advancing the catheter at the same time you're removing your stylet. You see that? We keep on doing so until we put the catheter all the way through. Now we're holding steady. You see how my fingers are holding this steady right at the hub. It's not getting contaminated. We remove the tourniquet. We have our thing ready there to go. It's going to be a little bit of blood, but you do it on a sweep motion. So you want to make sure that you remove this, cover it, and then you're going to connect it, and you're going to twist it. Look at my fingers where they're at. I'm holding the hub, and I am performing a twisting motion to lock this in place. Okay? You have extra gauzes that you can use to clean, to remove any extra blood. Then you're going to aspirate, make sure that it's still in place and you see the blood. You're going to flush the system with the amount of saline that you have in there. Pay attention to my fingers. I'm not touching the side at any time. I give it the flush. I put the needle back into the cap in there so I can put it in the sharps container, and it's covered and it's away from at low risk to giving me any puncture. So I'm just want to make sure that I remove this with my hand. Okay, and then I'm going to tell my client, will you please remain still for me, because now I'm going to tape it. I let go of that, but I'm holding it at the same time just to make sure I give the patient enough time to register that and say, yes, I'm holding still. If it's a client that is confused, you want to make sure that you tell your partner and say, I'm going to remove this, please keep him still. And then you're going to remove it, and you're going to get your tegaderm, and you're going to cover the hub of the catheter with the tegaderm. You're going to remove and save that part because you have the number in here for the date and the time. Okay. At this point, then you're going to have your tape, and you want to get enough piece that will create a U, something about this long. You cut it, you get 2, see how I did it? So now with this part, you're going to get the sticky part up, you're going to go right underneath it, and you're going to catch the extension, and you're going to create a U. You're going to fold it and up, fold it and up. You see how I created a U in there? And with this extra piece, then you're going to cover the contour of the extension and anchor it in place. This is one of many ways that you can tape the IV, and we'll discuss the rest of them in lab. Then you're going to get another longer piece, and you want to make sure that you loop your extension and that you tape it in place. Remember that you have this part in here where you will put your date, time, and initials, and you're going to put it in a place where it's away from the site, away from the site. You want to make sure that you take this to the sharps container, and that you have cleaned every area, all the things that you have in here. Including your gloves. And how do you take your gloves off? You grab it by the middle, make a ball into your other glove, go underneath it, remove them. Make sure you gather everything and put it on the trash bag, on the red bag. Okay? And then you are making sure that you leave your client safe, rails up, whole bed down. And you document it. You're going to document the site, the size of the catheter, any issues that were during the procedure, and then you're going to proceed with whatever order you had for solutions, either the blood or the IV solutions. So this is how you perform an IV insertion on a client.